Our partnership with Eleos has yielded some very, very good results. And so that's the background. It's like that's how we got here. We needed to make sure we could do more with less. We needed to make sure we could keep services on the ground. We needed to make sure that our people had the work-life balance that they need, that they need when they come to work for us or come to care with us. And we needed to make sure that we could shape the recruiting efforts and maintain our staff. And so in doing so and partnering with Eleos for AI scribe and ambient listening and also compliance, we've been able to reach over 2,000 more individuals. So when I first started with our organization, productivity was very, very low, and the burden of completing notes was very, very high. And so our clinicians are feeling better because of our partnership. We increased our billable hours by 7,100 plus, and it's growing every day. And I was just in an operations meeting and it's getting better. The numbers are already changing, are already better than what's on this slide, and they're moving in the right direction. The one thing that I haven't seen yet is a dip in this. And so it's really going in the right direction. And our turnover rate, we've seen a 19% reduction in it in our turnover rate, which the cost of turning over an individual is drastic. And but one of the things we can't measure is how it impacts those individuals that we serve, because it does it so in a mighty, mighty way. And that's a qualitative impact of turnover that we really are concerned with. We've added more than $1.1 million in audit capacity. Our director reported out today that, she's so thankful that we are not focusing on auditing good notes. We can definitely focus our time and attention on auditing the notes that we need to audit instead of all the good notes that are already baked into the system. And so she's proud of that. And people are reaching out to us to get demos for the compliance tool because they want to be able to do the same for their teams. And the documentation hours is what keeps me um that it just keeps me grounded because that equates to reduction in clinician stress, people being able to be with their family members and not worry about what writing notes or serving people and whether a note is good or not. They're worried about whether the quality of that service is good or not.